guy. SEIU has been a major leader in healthcare reform as well, is on the National Healthcare for America Now Steering Committee, and represents over 1 million healthcare workers nationally. And so we're honored to have an RN from UW Hospital, Lesli Wright, who is a member of SEIU, to speak from a provider, nurse's perspective on the healthcare crisis. So Lesli?
Hello, my name is Lesli Wright. I am an SEIU member, and I have been a registered nurse for 18 years. I believe that this is a great opportunity to speak about quality, affordable health care for all. Right after the 4th of July, our country's Independence Day. Health care should be a right for all Americans, not a privilege. A good life is often measured by good health. Worrying about how much the bill will be should not be the determiner of whether a person seeks health care. We need quality, affordable health care for all. Both professionally and personally, I have witnessed the cost of the lack of health insurance. People are forced to choose between food and medication. The first of the month often allows for a temporary reprieve for suffering and worry for many Americans struggling to balance rising costs with their medical needs. As a hemodialysis nurse, I care for many patients who do not have private insurance coverage. Government-funded Medicare and Medicaid covered the cost. Industry standards set dialysis treatments at approximately $1,000 a treatment. Medicare costs will rise as the population continues to age. Senior citizens who have worked to save their retirement nest egg use their money for increasing Medicare B premiums, Medigap supplements, and increasing drug costs instead of enjoying their golden years. I am currently a home health nurse. I witness working families struggling to afford health care. Families are taking on more responsibility for providing continued needed health care due to rising health care and insurance costs. Some insurance companies place limitations on the number of visits available to patients, forcing patients and families to learn how to provide skilled care, with access to skilled medical and nursing assessments limited to clinic visits. Self-pay means full price. Managed care between healthcare providers and insurance companies often means a discount for the insurance company. State and county-funded chronic health care programs have long waiting lists. My family is very fortunate. My family has excellent coverage from both my employer and my husband's employer. We have the dual coverage. Each year I see that monthly premium rise. My son has a chronic illness that puts him at risk of being denied health insurance due to a pre-existing condition when he becomes an adult. Despite having good health insurance at this time, I worry about what will happen to my son when he reaches adulthood and is no longer able to be covered under my plan. My 2 adult stepdaughters have no health insurance coverage. According to a recent report from Families USA and National Healthcare Consumer Group, Wisconsin has one of the worst records regarding individual health insurance consumer protections in the country, especially for those who have pre-existing conditions. Recent healthcare proposals have offered tax credits that will cover only a fraction of the individual health insurance costs. The young and healthy often feel confident that they do not need health care coverage. A major change in health can result in financial ruin. Healthcare coverage through the largest possible pools will achieve affordable, quality health care insurance for the entire population and share risk fairly. Health insurers are putting profits before our health. Americans need a truly inclusive and accessible healthcare system in which no one is left out. Thank you.